This is Dr. J. Feldman. Today we're going to be talking about the side effects of the medication Adderall.
Let me ask you, what really makes a good doctor? If you're not happy, how are you supposed to help your patients?
So, I have been taking this medication all through college, through medical school. I actually didn't stop taking this medication until very recently. So I know a lot about it firsthand and obviously as a prescribing physician for a good amount of my career. Let's dive into the side effect profile of Adderall. We all know a lot of the positive effects from taking this medication. Those include euphoria, alertness, appetite suppression, and those come from a couple of different neurotransmitters being released. I promise not to bore you with the science, I'll be quick. So this medication works by releasing norepinephrine and dopamine from your brain, causing you to become awake, alert, and happy. Dopamine obviously makes us happy. There's a short-term effect and it causes those positive side effects that I just noted. However, it's not all positive. In addition to the effects that we're all aware of, some negative side effects that we also might be aware of are the effects that it has on our body. So, amphetamines are a vasoconstrictor, so effect number one, constricts your vessels, causes your blood pressure to go up, also causes your heart rate to go up. Amphetamines act directly on the heart to cause tachycardia. In addition to those kind of obvious physiological effects, Adderall and other amphetamines have been proven to disrupt your sleep cycle. So studies have shown that people who take this medication and medications like it have been shown to have lower, less effective sleep. So this negative affected sleep may also be responsible for the lower memory retention that has been seen with Adderall consumption. So there's a common misconception that Adderall also increases your focus and makes you remember things more. That's actually not true. Because you're alert, you're able to study longer because you're happy and you're alert. That's the effect that it has. It does not, however, make you focus. As I'm sure you're aware, if you've taken this medication, you can take the medication and instead of studying like you thought you were going to do or working like you thought you were going to do, you'll go clean your house or go on a shopping spree. Not focus, alertness. The effect on memory I thought was interesting. So it does decrease your short-term memory retention and also may have some effects on your long-term memory. This could be associated with the lack of sleep or the effect on your sleep cycle or a direct effect of the medication, we're not sure yet. What really concerns me, other than those short-term side effects, are some potential long-term side effects. And by the way, these are all just the most commons. There are some outliers, people watching this video who are like, Adderall-induced psychosis. Yes, amphetamines can also induce psychosis, including Adderall, so definitely be aware of that. And also if you take too much amphetamines, you can have vasoconstriction, you can have heart attacks, you can have strokes because not enough blood is getting to your brain. But again, these are very rare. They're usually due to improper use of the medication, so be sure you're talking to a doctor, taking an appropriate dose, and contact your medical professional if you're having any of those alarm symptoms. Now, let's go into some potential long-term side effects. And this is an area that is very controversial still. Because this is such a widely accepted medication, doctors are prescribing it kind of left and right without a lot of control or oversight. There's a common consensus that there are no long-term side effects, that the medication is safe for long-term use, and nothing bad is going to happen. I'm going to call BS on this, and this is just one doctor's opinion. But look at what the medication does. The release of dopamine. This is a common similarity with a lot of other addictive drugs. Crack, cocaine, heroin. All of these things cause instant dopamine release, just like Adderall does. So it could cause addiction, long-term addiction. That's just one simple one, kind of obvious. Some other ones that I'm a little bit more worried about, especially if you're using this drug long-term and you're having long-term negative effects on sleep, are early dementia. There's a lot of studies suggesting that ADHD symptomatology is associated with early dementia onset. Not necessarily the Adderall itself, but that's to be seen. I think a lot more studies need to get done before we can say that conclusively. But my worry is that Adderall may lead to early dementia and other cognitive disorders as we age, especially with long-term heavy use of these amphetamines without any vacation, without any time off. Again, a lot of this needs to be proven, but the long-term side effect that we can all brace for is definitely going to be addiction and some alteration of those receptors that release norepinephrine, release dopamine, so desensitization. You use a chemical long enough, you take 10 milligrams and you get a certain amount of dopamine released. You keep doing that for a month, that 10 milligram is no longer going to give you that same release of dopamine. You're going to need more to get the same effect. That's desensitization, leads to addiction, leads to you having to use more to get the same effect. Okay guys, I hope this was helpful. Again, I hope this was unbiased. This is a medication that I used for a long period of my career. I no longer use. I do not prescribe this to anybody. I'm not a proponent for it, nor necessarily am I against it. I do think it has its place for certain individuals with true ADHD. Would love to hear your thoughts though. So let's have a conversation in the comments. I would love to get into a debate with you, have you on the show, we'll discuss. And if you know anyone that takes Adderall, or whether it be your kids or yourself, someone else's kids, please send this to them so they can become educated themselves and make the right decision. See you in the next video.